To open an addiction treatment center in Wisconsin, you only need state certification if you want to accept Medicaid or state funding. Skip that, and you skip the requirement. Wisconsin does not require every addiction treatment provider to certify. The trigger is taking state dollars. Here is the operator's guide to opening an addiction treatment center in Wisconsin. The demand, the certification trigger, the 13 service types, and what it costs. We cover why Wisconsin makes sense, when certification kicks in, the 13 service categories, and the annual fee structure. Alcohol is by far the largest substance of choice for Wisconsin patients, and the state ranks third in the nation for adult binge drinking. By far the largest number of substance use patients in Wisconsin name alcohol as their drug of choice. Wisconsin ranks third in the nation for adult binge drinking, a clear demonstrated need for more treatment capacity. Wisconsin reports 21.1 opioid overdose deaths for every 100,000 residents, an opioid misuse rate above the national average of 4.1%. The state reports 21.1 overdose deaths for every 100,000 residents, concentrated in the Southeast. Wisconsin reported 397 cocaine-related overdose deaths in 2020, with year-over-year growth in cocaine issues since 2014. Behave Health's all-in-one app is designed to put admissions, treatment plans, billing, and insurance authorizations at your fingertips as you open your Wisconsin center. The platform is designed to bring clinical, administration, staff, admissions, alumni, and resident workflows together in one place. Billing and insurance authorizations are designed to live alongside the clinical record, so the back office works from one system. 3 things decide whether and how you certify your Wisconsin Addiction Treatment Center. Let us walk through them. When certification is required, the rulebook that governs it, and which of 13 categories your center falls under. First, certification is only required if you want to accept Medicaid patients or receive any type of state funding. If your center wishes to accept Medicaid patients or receive state funding, you must get certified in Wisconsin. Requirements can change. Verify current certification rules with the Wisconsin Department of Health Services before you open. Second, the Community Substance Abuse Services Standards, Chapter DHS 75, govern every rule that applies to addiction treatment providers in the state. The Community Substance Abuse Services Standards define which organizations must seek certification and the rules they operate under. Certification applies to services that receive funds under Chapter 51, or that a private agency requests certification for. Third, Wisconsin issues 13 different types of certification for 13 different categories of service. Identify which one your center fits. Wisconsin issues 13 certifications across 13 service categories, and each state names these categories differently. Because the language is state-specific, pinpoint which Wisconsin category your addiction treatment center will belong to. The 13 categories range from prevention and emergency outpatient services to detox, residential, and narcotic treatment for opioid addiction. Outpatient treatment is outpatient care with less than 12 hours of counseling per week. Day treatment is intensive outpatient with at least 12 hours of counseling per week. Medically monitored treatment is 24-hour residential physician-supervised treatment, popularly termed residential treatment. Wisconsin certification fee is based on how many services you offer, and each additional service is bundled in at an increasing discount. A traditional inpatient program with no extra services pays $550 a year, then $250 to add a service. 5 services under one roof run $1,350 a year, and every service after the first 5 adds only $100. Behave Health is designed to make it easier to operate evidence-based, results-focused addiction treatment centers, and can point you toward licensing and accreditation help. Clinical, administration, staff, admissions, alumni, treatment plans, and billing are designed to work from one connected system. Behave Health can help direct you to resources for licensing or accreditation through the Joint Commission or CARF. Stop juggling tools to open in Wisconsin. See admissions, treatment plans, and billing in one platform. Book a 20-minute demo at behavehealth.com. See the all-in-one platform built for behavioral health operators at behavehealth.com.